Cosmetic Dermatologist in Newport Beach, California, and today I'm going to be doing a video on Kybella. So the reason I wanted to talk about Kybella is because Kybella is an injectable fat dissolving solution, and there's so many areas that we can use it for dissolving fat or melting the fat pads or getting rid of some extra little fat that is stubborn and won't go away no matter how much you diet and exercise. And this has come up a lot in my office, and patients are coming in for body contouring and minimally invasive procedures, people who don't necessarily want an extreme treatment like liposuction but just need a little fine tuning to get rid of a little maybe extra fat under the chin area to kind of chisel out the jawline, or a little bit in their bra fat area or their back fat or along the waistline and the hips, even the medial thighs. And I feel like it's coming up a lot, and so I wanted to do a quick YouTube video on it just to kind of educate you guys, talk about the procedure, what it entails, and how Kybella works. So before I move on, I just ask that you subscribe and hit the notification bells, because I will drop a derm video every Saturday, and I'll keep the content coming. I'll keep you guys in the know with the latest and greatest in the different technologies and advances in aesthetics and dermatology, because it's a rapidly advancing field and there's a lot of information out there, and I just want to be a source of truth and honesty, and just to educate you guys and give you background information based on 20 years of education and training in this specialty. I also want to take this opportunity to say that as a dermatologist, I don't accept any paid partnerships, and everything that I post and I recommend for my patients are the best treatments that I am passionate about, that I see real life results with, and I just want to recommend what I feel is best for my patients, and not what a company is paying me to post or not to post. So I just wanted to throw that out there and remind you of this, and I will stay true to this. So what is Kybella? Kybella is deoxycholic acid, which is an enzyme that breaks down fat, and it occurs in our GI tract to absorb and break down fat and get absorbed into the bloodstream, and naturally occurs in nature. And Kybella, as an injectable fat dissolving solution, is the same enzyme, and it's safely and very meticulously injected into certain areas where you want to dissolve fat. So as I said before, usually it's the submental fat pad, or what we call the double chin, which I hate using that term, but to kind of just give us a better like AP projection profile, to sharpen and contour the jawline. It's been used and FDA approved for use in that area, but now we're using it a lot off-label, or I've been using it off-label for the last 10 years, I think, since it's been launched, to help fine-tune body contouring. So you know, when you work out, and no matter how much you're eating clean and how much you're working out, you just can't get rid of that stubborn fat that may be like in the armpit fat, or when your sports bra kind of squeezes the back fat, or the love handle area, or the hips, you know, or the medial thighs, or the area right above the booty to kind of shelf it out a little bit. That's an area that is very common for Kybella treatments. And the way the injections work is they lyse or break up adipose tissue cells, or the fat cells, and then it causes a little bit of inflammation. It can sting a little bit during the treatment, but that rapidly subsides within minutes of the injection. And usually if there's any pain or discomfort, it's right here in the chair as I'm injecting you, and it lasts for about 3 or 4 minutes. It's like a crescendo decrescendo, so it can get really painful and spicy, and then it goes away, and then it's done. And then for the next week following the treatment, you can have some increased swelling, or kind of some puffiness in the area where the Kybella was injected. So it's kind of a not very fun side effect to have when you're getting the double chin treated, because you almost look like you have an accentuated bigger double chin for like a week after the treatment. But after the swelling subsides and that skin retracts back, about 6 to 8 weeks later, you'll start to notice a definition in the chin and a decrease in the submental fat pad. Or if you're having it injected on the body for body contouring, after a week of inflammation, and as the inflammation dissipates, then you'll start to notice contouring and thinning of that area. So the reason why I like Kybella as an injector is because it's a little bit more specific and precise with the placements of the injections. So the reason why I like Kybella is because it's a very customizable and very precise injection point where you can actually target the fat pad. So unlike many other treatments, there's lots of devices that help remove fat. You have to fit into the applicator in order to have the fat treated. And there's been reports of, you know, paradoxical adipose hyperplasia, where basically you get fat growing in other areas where fat was removed. And with Kybella, I haven't seen any reported in the literature. Anecdotal evidence hasn't shown the side effect with Kybella, and I just feel like it's a more safe effective and more customizable treatment that can kind of be customized to each individual patient. For example, some of the fat dissolving or fat minimizing devices you have to fit into a handpiece, and say somebody's fat goes out a little bit more to the sides, or say it's more profound, in the more anterior, posterior area of the submental area. If you don't fit in that handpiece, you're not going to get the even fat distribution that's kind of customized to your face, to your anatomy, and to where your fat is. But if you're injecting it with precise little placements, you can fan it out further onto the lateral aspects. You can put it more anterior. If there's a little bit more fat here than here, you can kind of just be accustomed to that and customize it to each individual patient, which I'm all about customizing different treatments for each individual patient and what their ailment is and where their most problematic area is for more targeted therapy and better outcomes. And the reason why I like Kybella as an injectable is because, I've worked in offices where we have cool sculpting, liposuction, different fat dissolving or fat minimizing treatments. But the thing is that liposuction is a very involved surgical procedure. It can leave undulations, it can leave fibrosis, scar tissue. It can also be uneven in the texture after the liposuction is performed. And I like Kybella because it's for minimal contouring and not, of course you're not going to be doing Kybella if you have a substantial area of fat that needs to be removed. Then liposuction would be a better treatment option. However, for people who don't necessarily want to go through a surgical procedure or the risk for scarring or irregularities in the skin texture, Kybella is perfect for that because you're inducing your body's own processes to remove the fat, clear the fat, and it just gives a more natural, even distribution of the fat erasing area. So in an area, for example, like the armpit fat or back fat that kind of squishes out in your sports bra, you may not necessarily be a candidate for liposuction, and a device may be hard to target that fat, and that's where Kybella comes in beautifully. By just injecting into those areas, the area will flatten, the fat will diminish, and it'll help contour out that body line that just is giving you the results that you want with minimal risk for scarring or side effects. And that's why I love Kybella so much, and I use it a ton in my office, and I love it for body contouring and for treating the double chin area, although I hate using the name double chin because that sounds terrible. So what is the downtime and what are the side effects? So side effects for body contouring with Kybella are very minimal, and when done incorrectly, side effects can include something called demyelinization of the nerves, which I've actually never seen in my career, knock on wood. It's been a possible side effect reported by the FDA, but I actually have never seen any side effects from Kybella. I feel like the biggest risk of Kybella is if you don't get the results that you want, and that's usually for people who have a substantial amount of fat that is going to probably require a treatment like liposuction or a surgical procedure to remove the fat. The other side effect that's not very fun is swelling. So you get a little bit of swelling after the treatment, which on the body, especially for like back fat, bra fat, abdominal fat, inner thigh fat, when you have swelling in that area, it's not very noticeable. However, if you're treating a double chin, it can become, we always call it like the bullfrog look. You can kind of get accentuation of that under chin fat pad, and it can actually look worse than it was before during the swelling period that lasts about 1 week after the treatment. But then after the swelling goes away, that skin retracts back, and about 4 to 6 weeks after the Kybella treatment, you'll notice a more chiseled jawline, a minimization of the fat pad, and it may require more than one treatment, but you'll definitely notice a result about 6 to 8 weeks after the treatment. Sometimes anywhere from 1 to 3 treatments are needed depending on the patient satisfaction. If they're like, I love this, I had 1 treatment and I'm good, I'm happy with the results, I'm done, then only 1 treatment's needed. If somebody's like, ooh, I had an improvement, but it's probably like a 30 to 40% improvement, I want a little bit more, then he or she may require 2 or 3 treatments. And we usually space them about 2 months apart. Every provider is different. I'm just basing this on my 15 years of experience, and this is what I see in my clinic works the best with my patients. And I always tell patients it may be anywhere between 1 to 3 treatments, depending on how happy you are with your results. But I don't think I've ever had anybody who's not happy with Kybella, and if anything, they like their results and they just want a little bit more. So some of you might ask, well, what is the pain like during the procedure? So everyone's different. People report back to me that the pain level is anywhere from like a 4 to 5 on the pain scale, 10 out of 10 being like the worst pain ever. But it's usually 4 to 5 or about 3 to 5. And it's usually like a crescendo, decrescendo. So as I'm injecting, you're like, ooh, that's a little bit spicy. We use some ice packs and we kind of try to calm you down. And then it gets better about 2 to 3 minutes later. And then there's no pain afterwards, just swelling. And something I've been doing a lot in my office too, which I really love and patients really love as well, is kind of body contouring in the lower back and booty area. So if we're doing M-Sculpt and Sculptra to kind of increase booty volume, and then right above the booty area to kind of like carve out that waistline by minimizing fat in the hip area and the lower back area with Kybella, those results are next level. And it's like permanent and there's no surgery needed, there's no downtime, and results are amazing. So that, my beauties, is the Skinny on Kybella. Perfect for body contouring, perfect for submental fat, may require more than one treatment, and there's minimal risk and downtime to this procedure, which is why I love it so much, and it's customizable. So I hope that makes sense. Leave a comment and let me know what else you guys want me to talk about. Be sure to subscribe and follow as I drop new dermatology content every Sunday, and thank you guys so much for watching. Love you.